Here I will go over some of the medical conditions that are listed for this question. And the first condition is Marfan syndrome, which is an autosomal dominant disorder that is caused by mutations in the fibrillin gene. So the way I memorize it is that Marfan is associated with mutation in the fibrillin gene. And these patients present with upward subluxation of the lenses, aortic regurgitation, aneurysm, as well as dissection. And these complications are due to cystic medial necrosis of the aorta, where the muscles and elastic fibers in the aortic media is replaced by the mucopolysaccharides. So the vessel wall is composed of three layers: the adventitia, the media, which is shown as a yellow layer, intima, and then the endothelium. And so what happens is that in patients with Marfan syndrome, they develop cystic medial necrosis, where the muscles and elastic fibers are replaced by mucopolysaccharides, as a consequence of which blood can leak from inside the vessels into the media and cause aortic aneurysm or dissection. And here is an example of aortic dissection, which is shown by the arrow. So here is the ascending aorta, and then we have the aortic dissection here. And here is another example of aortic dissection that you can see right here. Now, the other condition that is associated with these patients is long extremities. And this is due to increased bioavailability of transforming growth factors. And thus, patients with Marfan syndrome present with thumb sign, where when they close the fingers over the thumb, still part of the thumb will be sticking out. And the final condition that is associated with Marfan syndrome is baryaneurysm, which can cause subarachnoid hemorrhage that presents as the worst headache of life. And one last point that I would like to mention here is the risk factors for abdominal as well as thoracic aortic aneurysms. So for thoracic aortic aneurysms, risk factors include high blood pressure, Marfan syndrome, as well as tertiary syphilis. With abdominal aortic aneurysm, however, the main risk factor is atherosclerosis. And then there are other risk factors such as age over 50, male, smoker, and high blood pressure. So just keep that in mind, that atherosclerosis usually leads to abdominal aortic aneurysm versus high blood pressure that is mainly associated with thoracic aortic aneurysm. But high blood pressure can also be a risk factor for abdominal aortic aneurysm. The next condition that I'm going to cover is Williams syndrome, and Williams syndrome is due to the deletions on chromosome 7, as a consequence of which the elastin gene will also be deleted. And the mnemonic that you can use to memorize the features of Williams syndrome is Williams. So W goes for well-spoken, S goes for stranger friendliness, I goes for increased vitamin D sensitivity and increased calcium. L, two L's, one goes for elastin, and then the other L goes for elfin features. A goes for aortic stenosis, and finally M goes for mental retardation. So by elfin faces, here I've provided you a drawing that you can see that these patients will have small chin with prominent lower lip, widely spaced mouth and spaced teeth, as well as long philtrum. So this is how they present with elfin faces. The next condition is Beckwith-Widman syndrome, which is due to deletions on chromosome 11. And these patients present with variety of internal tumors, omphalocele, large tongue, as well as hyperinsulinemia. And here I'm providing you with a memory aid that can help you memorize the features of this syndrome. So the eyes are two numbers 1 with a really large tongue. Then he has the omphalocele. He is holding a candy. And then internal organs, we have the liver and the kidney and the adrenal glands. So 1111 goes for chromosome 11, where mutations are associated with the syndrome. Large tongue, candy goes for hyperinsulinemia. Omphalocele. And finally, liver, kidney, and the adrenal glands, these are usually the tissues that will develop tumors. And so you can use this memory aid to memorize the features of this syndrome. The next condition is Kallmann syndrome, which is due to the defects in the GnRH hormone. So GnRH, which is produced by the hypothalamus, and thus due to the decreased production of GnRH, these patients will have decreased FSH, decreased LH, decreased estrogen, decreased testosterone, and decreased sperm count. So they would develop lack of secondary sexual characteristics. Like females will lack breast or axillary hairs. They would also have primary amenorrhea, and then in males they would have small penis with decreased muscle mass and no deepening of the voices. And then the other feature is anosmia, which means that these patients cannot smell, and this is due to the fact that GnRH cells cannot migrate to form the olfactory bulb, and thus due to the lack of the olfactory bulb, these patients cannot smell. The next condition is Cri-du-chat syndrome, which is due to the microdeletions on chromosome 5. And these patients usually present with ventricular septal defect, microcephaly, and a high-pitched cry that resembles the sound of a cat. So cat-like cry. The next condition is cretinism, which is due to the congenital hypothyroidism. And these patients present with mental and growth retardation. So the memory aid that you can use to memorize the features of cretinism in addition to mental retardation includes 5 P's. So here I have an image of a patient with cretinism. So he has pale and puffy face, protuberant tongue, pot-bellied, and then finally protruding umbilicus. So you can see how by 5 P's I mean pale, puffy, pot-bellied, protuberant tongue, and the protruding umbilicus. And then the final condition is Kwashiorkor syndrome, which is due to the malnutrition, as a consequence of which these patients will have low albumin in the serum, and thus due to the decreased oncotic pressure, there would be leakage of fluids, and thus these patients will develop edema. And so here is an image of a patient with Kwashiorkor syndrome, where there is usually swelling of the ankle and feet, as well as the enlargement of the abdomen in these patients. And that concludes our discussion.